Hello, this is Dr. Stanley Lang. Welcome to this broadcast, which is on the topic of stress and exercise. And you might think that I'm going to talk about how exercise helps to decrease stress, and that's not the main point of this one. It's when exercise causes stress is the main thing I'd like to share about today. Now, clearly, stress reduction, one of the most powerful tools for that is an appropriate exercise program. And I've been teaching that for more than 30 years. So there's no breakthrough information there. But what I want to focus on today is an experience that I had with a patient where we demonstrated without a shadow of a doubt that there was too much exercise going on and it was actually stressing this person. Now, there are a lot of times that I'm kind of suspicious that that might be the case, but most of the time we don't have any metabolic markers that demonstrate that there's actually a consequence to the person's perhaps excessive stress or exercise program. And in this case, because of some different reasons, this person has required a hormonal replacement program for a while. And because of some decisions that were made, decided to put that hormonal replacement on hold for a while because of needing to check out the heart more. So the heart got checked out in a lot more detail, and in the process went at least 3 months without any hormonal replacement. And this hormone level has been previously measured even with replacement, and so I know where the numbers have been. And the hormone in question is testosterone. And the idea that men feel like they need extra testosterone sometimes to help them in different situations, this is well established. And some men think that they need extra testosterone to actually exercise better. That's been established, of course, and it's one of the causes for doping infractions with elite athletes. Well, this person, because of recommendations from the cardiology group and our own discussions, elected to back off from the intense exercise and just do modest exercise for 3 months, but also to not use any extra testosterone. And what happened today is that we remeasured the testosterone levels, and he's not been taking any extra testosterone now for several months, and lo and behold, they came back right in the middle of normal. He wasn't even close to low. They were right in the middle of normal, which showed that by backing away from the very intense exercise that he'd been doing, that he actually was able to, his body was able to reset and was able to generate sufficient testosterone, and that he didn't need to be supplementing in the first place. But he had been under so much stress in previous years, and his exercise program was simply adding to the stress because he was exercising to try to get rid of the stress, but he was pushing himself too hard. Now, as I said, for most people, they're not exercising enough. And so I want to make it clear that stress is the most powerful tool for dealing with stress as an effective exercise program. But on the other hand, you can't overdo it. And when you do overdo it, it causes stress. And when you have stress, lots of things go wrong. And this was a beautiful example of how stress dramatically suppressed testosterone levels in a male who was otherwise pretty healthy. And so other causes of stress will also suppress testosterone level. There's lots of different things in physical, emotional, and spiritual causes of stress that will suppress testosterone in men and other hormones in both men and women. So controlling stress is really the key to being in the best of health. And so I encourage you to take advantage of anything that teaches you how to control stress better, but not to do things to excess, especially when it comes to exercise, because that will cause a stress response, and then that will actually increase risk of disease. This has been well established for marathoners people training for endurance exercise, they have a long history of getting sick more easily because they've basically worn down their immune system because of the chronic stress response. So in summary, I do want to encourage you to exercise, but if you happen to be one of those folks that overdoes it, you're probably harming yourself. You're probably knocking down some of your key hormones and pushing the stress hormones up, like cortisol. So I hope you found this helpful, and I wish you well. God bless, and have a great day.